We are here at 4th Avenue Medical Aesthetics, and we were just here a couple of months ago for the winter, but that was winter. Spring is on the horizon. We are here because Jacqueline is showcasing a whole bunch of new products for us to get ourselves ready for the new season. Hi, Jacqueline.
Hi, good morning. Welcome back.
Thanks so much for having us. What is happening to my arm right now?
So Zoe right now is doing cryotherapy. So what this is freezing, so mole removal essentially. So there's been new advancements with this, which is really nice because you'll go to derm and they will take moles off with the freezing, which is quite common. We've really struggled with bringing it in. We've had a lot of interest in it. However, these new advancements with this pen is more precise.
Okay.
So it's less damaging to the skin around, and it's a quicker procedure and less pain.
It doesn't hurt at all. Like it's like a tiny little sting.
That's it.
But for the most part, like it's really comfortable. And I've had it done with the big honking machine that like comes
That's
at
right.
you. And you definitely feel it.
More aggressive, and then the problem with it is the reason I want to bring it in is because these moles are very small and very precise.
Yeah.
So now we can bring the pen in and we can actually treat the moles. In most cases, they'll go in 1 or 2 sessions, and now we're not damaging the skin around it, and you're not getting the pain that you did when you went to derm.
No,
which
not
is really
at
nice
all.
as well.
And
yeah.
what about healing time? How long does it take to heal?
Healing is different for everyone based on your skin type, based on how healthy you are, but realistically, a couple days, it's going to kind of cup up like a blister or a scab, just kind of like you picked an area.
Okay.
And then you're going to leave it clean to dry. We don't need to put any creams or anything on it, any antibiotics, and then it's just going to fluff off.
And that's it,
gone.
eh?
And gone. Yeah.
It's so simple.
It's so lovely. It's great. It works really, really well.
Take me through exactly what it can take off.
So we're looking at moles, keloid issues as well. So with me specifically, I have 3 spots that they're reddened. I've had them since I was a little girl.
And are they birthmarks?
It kind of seems that way, but they actually said it was a cellular calcium buildup. So they're actually very challenging to get rid of, and I just opted not to get rid of them because of derm and how much it costs and obviously the downtime.
Yeah, of course.
So I actually used the pen on it for the first time, and they're gone 50%.
No way.
Yeah, and my skin looks great. No scar tissue, no redness, no nothing. You wouldn't even know they were there.
That's incredible.
Yeah, it's really great.
Okay, so we could do that. We can do moles. We can do sunspots.
You can do freckles. So if there's a freckle somewhere that's bothering you, you can actually do that as well. Yeah.
Really?
Yeah, definitely.
Interesting. Now, does anybody come in and is like, okay, do my whole face, I hate my freckles, gone?
It's entirely true. I did have a gentleman come in recently and he had 14 of them on his neck. So the problem is when we're wearing clothing, they're rubbing and we actually get skin tags.
Yeah.
So he had 14 of them on his neck. So we treated him. Honestly, it really took, I think, about 20 minutes, not very long.
Yeah.
We treated him. There was minimal downtime, minimal pain, and they're gone.
Okay,
Yeah.
well, what else are we going to be showcasing today?
So we're going to be looking at PRP hair restoration. We're also going to be bringing in new exosomes, which is our stem cell therapy microneedling.
So
that's
cool.
another one as well that we're going to do. And then we're going to do body contouring on you.
Body contouring.
Yes.
All right,
Summer's coming.
Getting my body ready
Yes.
for the summer. So how long are we going to contour for? Like a couple hours, right?
Right? 20 minutes.
Okay, there's so much more coming up on Morning Live. Don't go anywhere. Okay, this is some of the coolest next level technology that you guys offer here at 4th Avenue. Jacqueline, tell us exactly what's happening to Mateo right now.
So right now is always cleaning his head. So we're getting ready for our PRP hair treatment. So what it is platelet-rich plasma. So what we did is we pulled his blood. So there's no chemicals involved, which is really lovely.
Just his
no
blood.
allergic reaction, just his blood, just his healing factors. So what's going to happen is we pulled his blood and we spun it. So we released his red blood cells from his platelets. So his platelets are clear and yellow, and that's what's going to heal the follicle when we inject it.
This is so next level cool to me. I just find this so fascinating. And people come in because they notice that they're starting to thin, or they do it as like a preventative. Can you fix someone who's already bald?
So this is the thing. We get so many clients come in and they're like, my husband wants this done, but the problem is I always have to ask the question, how long have you lost your hair for?
Okay.
So if it's been within about a 2 to 3 year lull, and I can see that there's an actual follicle there, but it's just not growing, then that's something that we can obviously, hopefully, get back to where it needs to be.
Okay.
So when we do PRP, if there's a follicle, we're going to regenerate the follicle, so we're going to make it healthy and we're going to have hair growth.
Okay.
Yeah, so we can't do somebody that's lost hair for 14 years, unfortunately. I wish we had that power,
Because
but we
the
don't.
follicle like dies off?
Once the
or...
follicle's gone, we can't regenerate it. There's no follicle to regenerate.
Okay.
Yeah.
Okay, Zoe, show us the magic. I kind of want to see this thing happening. So she's cleaned his head, and
Yep.
now she's going to take.
So the nice thing is here is this is the vial here. So when we pull it, it's red blood cells entirely, and we have this little gel substance. So when we spin it, what ends up happening is the red blood cells, which do no use to us at the moment when it comes to regenerating, we want this stuff. This is the liquid gold right there.
Right.
So we pull that and we inject it. So we don't just do it in hair, we also do it under eyes. We do it on faces as well. So a lot of patients do come in with bruising, darkness, puffiness. We can inject PRP to start cellular renewal.
That is so cool. I love the fact that you're using what Mateo's already given
That's
you.
right.
Like
Right.
there's no extra additives or anything else that's going to be
Nothing
going
else.
into his system. And how fast does this work?
So we do say be patient because we are regenerating follicles. So what we're trying to do is make it healthy and then get that hair growth. So it does take time for that hair to start growing and come above the surface. So I say about 2 treatments in, usually about 2 months, we should start seeing baby fluffy hair.
That's nothing. 2
And
months
it
is
happens
nothing.
a lot. I actually have many women clientele with big bald spots or thinning hair. And the best part about this is I get them in the chair and I do 1 or 2 sessions, and it's so heartwarming because they come in and things have progressed and they're getting their hair back and they're in tears just saying thank you because it increases their confidence and they thought they were at a loss with hair loss, and it's just such a simple, easy procedure.
Yeah.
And here we are. Things
And it's
are
not
back to
painful,
normal.
right?
Feels great.
It feels great. It's like getting a head massage, right? Yeah. So this picture on the wall, Luke, if you can spin and just show it, that's after how many treatments?
So that's 2 treatments.
2 treatments.
Yep, so that's about 4 months out after 2 treatments. So the hair growth is incredible.
Oh my gosh, that is so amazing. I love what you guys do here because you don't change the appearance of people, you just boost people's
We're
confidence.
just trying to make people more confident. That's our goal. I'm not trying to change the looks of people.
Yeah.
That's not what we do here. I know society and social media has kind of gone that way, but we're sticking to our ethics, and
Yeah.
we're just trying to make people more confident.
I love it. Okay,
Whatever
there's
we can
so
do.
much more coming up from 4th Avenue Medical Aesthetics. We are always our own worst critic, but it is not about changing our appearance. It is about being the best that we can be. And right now, I'm saying goodbye to my double chin, Jacqueline. This is great. What's happening?
So this is radio frequency. So we're doing topical heat applied, so very safe. So what it's doing is it's breaking down the tissue underneath the skin and it's tightening the skin up. So it does eliminate double chins. So this is our getting summer ready procedure. So now that summer's fast approaching, we're going to see more patients booking this for double chins. We do stomachs, arms, legs, and what it does is breaks down that excess tissue. So people that are trying to lose weight, this is kind of a kick. So what we do is we do tell them you still need to continue with the gym and the weight loss, but then you come in for these treatments for about 20 minutes once a week, and we start breaking down that excess tissue.
Okay, so how long does it normally take to see a improvement?
You're going to see a result right away.
Really?
Yes, definitely. So every time you come in, you're progressively going to see more and more breakdown.
Okay, and how many treatments do you normally take?
I usually say you want to do about 6 because it does work pretty quick, but sometimes there is some stubborn fat, and we are sometimes targeting areas that are a little more aggressive.
Right, like if you were to do someone's bum.
That's right. So, and we can sculpt with this as well. So we can sculpt cheeks, we can sculpt bums
What do you
as
mean
well.
you can sculpt? What does that
So
mean?
what we do is we take the tissue away underneath and it starts forming the other tissue up top. So it gives you a little more sculpt to your face or to your bum, which is
no
really
way.
lovely. Yeah.
That's really cool. And there's nothing invasive about it.
There isn't, and it's very relaxing, right?
Yeah, it's amazing.
It feels good. Realistically, the only thing that I do say is it is heat. So if you don't like the heat, then that's a little bothersome, but we haven't come across that yet.
It's not that hot though.
It's not.
Like,
so,
I've been hotter in a sauna.
and minimal rest.
Or a hot tub.
So I find after the procedure, the first 2 times you're going to be a little tender. Otherwise, going forward, you'll be a little pink for about an hour or 2, and then you won't even know you had it done.
Yeah, it feels really, really nice. And it doesn't take, so how long is each session?
20 minutes.
20 minutes or so?
Yep.
That's really not a long time to get the results that you get.
It really isn't. It really isn't. And it does work wonders. We've been doing this procedure for many years, and it's extremely safe.
And it's not just for women.
Women, men, we do everybody. Yep, definitely. Yeah.
And do men come in and get the same kind of areas done?
Double chin is the big one for everybody because that is such a hard area to get rid of, and realistically everybody's always looking at that facelift, but they could try this first to see what results they can get and how quick we can remove that skin for them and that tissue.
And then my famous question, how long does it last?
Permanent. Permanent, permanent, permanent. So, which is a great thing, but I do have to tell my patients, permanent as permanent can be, we do age every single day. So
Yeah.
the more aggressive you are aging, then obviously it's not as permanent as it's going to be. We are changing every single day. Some people age faster than others.
Now, what about staying out of the sun after you get these types of treatments done?
We do say 24 hours. We are very vigilant on SPF, even if you're not getting a treatment done. The sun does age you drastically, and that's a big reason why we have these wrinkles, sunspots, we have these issues with our skin, is 60% of
Like
it at
you're
least
talking
is the
right to
sun,
me.
right? Wear your SPF. I can't say it enough.
It's true. Okay, so we've done some amazing treatments here today. We've seen skin tags removed. We've seen hair regrowth with your own blood. We've done this treatment, getting rid of my double chin. And then coming up, what are we talking about?
So next we're going to do microneedling with stem cells.
So cool. And like you do something with fish too, don't you?
We do. So we do have another product as well, which is similar, but it's actually derived from salmon sperm.
Okay, that is the
Yes.
coolest thing ever. Science is alive and well here at 4th Avenue. There's so much more coming up on Morning Live. Okay, Bethany is already stunningly beautiful, so what could she possibly be doing to her skin to improve?
So today what we're doing is microneedling, but the kicker here, something new that we brought in, is called exosomes. So
Okay.
it's plant-derived stem cells. So what stem cells are is, what they do is, they're different cells that communicate with each other, and it induces collagen production, elastin production. It actually increases healing rates.
Wow.
So Morpheus, you have a bit of a downtime. If we use the exosomes, then it actually decreases your healing rate by 50%.
What?
Yes, incredible. By the time patients get out of the room
Yeah.
to check out, we find a 50% decrease in the redness.
Oh my gosh, that's
Yes.
incredible.
So it's extreme healing. So this is a newer advancement in medical aesthetics, and it's plant derived. So again, we're not using all the chemicals. We're
Yeah.
not using, so there has been exosomes in the past that are coming from human DNA,
Yeah.
which can be very contraindicated.
Well, and it could be a little bit controversial as well, I'm
Right?
sure.
So we've really gone away from that, and these are actually extracted from roses specifically.
Oh, of course they are.
Yes.
It doesn't get any better than that. It's not just, daisies or daffodils.
That's right.
It's roses
So when it
specifically.
actually comes to the products, this is your top of the line product right now that we can get.
Now, does this hurt?
No, not at all, actually. She's numbed at the moment. You see a little pinkness with her doing the microneedling, and then the exosomes are going to decrease that inflammation and that redness when she leaves.
So is the exosomes in the actual mechanism itself, or do you have to put that on after the fact?
No, Katrina's applying it right now. So she's applying it during the procedure, so it's going into the skin below the surface.
Cool.
And then as well, what we do is we send you with morning and night care that have stem cells in it as well.
Okay, and how many treatments do you need to make this kind of the most effective?
We like to see 3 treatments, but patients do come in just for a single treatment. So for me personally, I've had a lot of my treatments done, so I'm going to do one or two a year just for maintenance.
Okay, because this is kind of an investment. You're investing in your health, you're investing in your well-being, you're investing in your confidence, and it can be kind of expensive. So the fact that you only have to do one a year of maintenance keep up, that's incredible.
That's the thing, is everybody thinks we're constantly in here doing different procedures, but if you're doing the right procedure and you're following our treatment guidelines, then realistically, you don't have to keep coming in for procedures all the time, as long as we're doing the right ones.
Yeah.
Yes.
And when people want to come in and sit down and chat with you, will you do a consultation? Like
Free consultation.
Here's what I think you need. Here's what I don't think you need. Because I know for me, something like this is really overwhelming because I'm not used to it. It's not really in my wheelhouse. So if I was to come in and sit down, I'd be like, so I want this fixed, and I want this fixed, and I want this to be changed, and I want this to be changed. But you would kind of streamline it for me.
Very common. So patients come in, we let them know our consultations are completely free. We give them about an hour for their consultation. I want everybody to be educated. We want to get on the right treatment plan, make sure it's appropriate. We're not looking at money. We're not looking at those things. We're looking at how can we best treat you and get the best of our dollar and get the best results. I want my clients walking out of here happy and treated and looking beautiful.
Well, the simple fact that you guys have so many certificates and you have won so many awards, your reputation just speaks for itself, I think.
No, thank you. Yeah,
it's true.
Another big one that we brought out actually is VAMP, it's called, which is it's salmon sperm DNA.
Oh, right, that's the same as
we can't forget about that. So we do have this treatment, and then we have the new one that came out, which is salmon sperm DNA. So yes, similar. It's going to do the tightening. It's going to do cellular renewal, but it's also another neat thing that's coming through with no chemicals and a new advancement in aesthetics.
I love the fact that being a nurse, you know the next best, greatest, coolest technology.
It's a great job. I
Yeah.
absolutely love it.
Amazing. Okay, well, we always have such a good time when we come here to 4th Avenue Medical Aesthetics. We're going to have all their information on our website at chch.com. Thanks for having us, Jacqueline.
Thanks for coming.